Hi, Dr. Shir Lynn. Heard you have recently concluded your research study. What is it about?
So this study is called NUHCS, which stands for Early Neuroprognostication for Out-of-Hospital Cardiac Arrest. In this study, we followed adults who were resuscitated from cardiac arrest at 0, 24, and 72 hours, and we collected blood and urine samples at that time. So we use advanced lab techniques to test for proteins and small metabolites, small molecules in the body, and to see which gives us the best readout, the best signals as to who would have the best brain recovery.
What is neuroprognostication and why does the 24-hour time point after cardiac arrest matter?
Well, neuroprognostication is estimating the likelihood of brain recovery. So in this case, we are using proteomics and metabolomics to signal to us who are our patients who are likely to wake up and to return back to how they were before the injury.
What are proteomics and metabolomics, and how can studying blood and urine samples reveal recovery insights?
So in these patients, we actually would collect the blood samples, as I talked about earlier, and proteomics is the study of a large number of proteins in the body, and metabolomics is the study of small metabolites or small molecules in the body. Metabolomics, the small molecules, they give us an idea of how the body is coping at a time. So together, the proteomics and the metabolomics, they give us a snapshot of the biological status of the patient at that point in time. With a simple blood and urine draw, this is able to tell us whether or not our patients are able to wake up with good function. And we found that 24 hours was the best time point. It gave us the clearest signals, and it distinguished between those who did not do well in terms of brain recovery and those who did well in terms of brain recovery.
How could these findings change real-world care for cardiac arrest survivors?
So at this point in time, the guidelines suggest we only estimate the recovery at 72 hours. And 72 hours is a long period of distress for the family members, and it's also a period of uncertainty for the doctors. Our data show that we are able to tell this clearly and earlier at 24 hours, and if we have an earlier signal, this will be able to guide the doctors in terms of their management, and this will be able to facilitate our discussions with family members now that they have a clearer idea of their prognosis. So our study is only a pilot study, but it definitely laid the groundwork for future multi-center study for us to confirm our findings and be able to use this in the clinical protocols.
Thank you, Dr. Shir Lynn.
Thank you.